Hello! This presentation is to provide information about caring for patients who have undergone a laryngectomy. My name is Liz Ansel.
My name is Michael Schramm.
And my name is Kara Garcia. Thank you for joining us.
First, we will begin by telling you what a laryngectomy is. A laryngectomy is a surgical treatment used to treat cancer of the throat if the cancer is spread to your voice box. In this procedure, the voice box, also known as the larynx, is either partially or completely removed, depending on the needs of the patient. If your voice box is completely removed, then your windpipe, also known as the trachea, will be connected to a hole called a stoma, which allows you to breathe. This diagram shows how the airway changes after a laryngectomy. If a total laryngectomy is performed, this may negatively impact your ability to breathe, swallow, and speak. In that case, a speech-language pathologist can help you to improve your swallowing and speaking abilities. A respiratory therapist may also work with you to help you with your breathing.
Now we'll talk about post-surgery complications of a laryngectomy. Complications after the surgery can be life-threatening, and it is very important that the patient is appropriately taken care of. Some complications include infection, bursting of the carotid artery, swallowing problems, or respiratory failure, which would require CPR. An infection may be noticed by increased redness, increased pus or drainage, or pain. An infection can occur at the stoma, in the trachea, or in the lungs. Infections need to be treated by antibiotics, which can be prescribed by your doctor. A rupture of the carotid artery can occur from very forceful coughing, or if an infection has eroded the walls of an artery. If you are experiencing difficulty swallowing, such as excessively coughing while eating or difficulty moving the food from your mouth to your throat, you should contact your doctor or a speech-language pathologist. If respiratory problems are noted, such as the patient is not breathing, CPR needs to be performed over the stoma while closing off the nose and mouth.
One way to avoid infection at the stoma is to do basic regular maintenance. This includes wiping the area with a clean cloth and warm water to remove any dried secretions. After, wipe the area with an approved ointment, such as Vaseline. When you breathe through your nose, the air in your airway is typically warm and moist. So, the patient's environment should be kept at a comfortably warm temperature, and a humidifier should be used so that the air in the patient's airway remains warm and moist.
After a laryngectomy, there are several options for communicating. If the patient's speech is affected from the procedure, there are several options for maintaining good communication and speech abilities. Esophageal speech is a kind of speech where air is taken through the mouth, trapped in the throat, and then released back through the mouth. This makes the esophagus vibrate, and vibrations are the basis of speech. Once the patient learns this step, sounds and words are made the same way that they always are before surgery, using the lips, tongue, teeth, and more. However, many patients struggle with this kind of speech. An artificial larynx can also be used for communication. This is an electromechanical tool which provides the vibration needed for speech. These can either be held against the outside of the neck or placed in the mouth. This method also requires training with a speech-language pathologist, although it does sound relatively robotic. Finally, a tracheoesophageal voice prosthesis, or TEP, may be inserted at or after the time of surgery and connects the airway and the esophagus. The stoma must be covered by a finger or a one-way valve. Air is directed from the airway to the esophagus, and vibrations travel upwards to produce sound. It is the most natural sounding way to speak out of all the three options. Additionally, one can communicate using writing or gestures in the meantime.
Sleep is important for maintaining a high quality of life and promoting recovery. The patient's bed should be placed at a 30-degree incline. This promotes healthy drainage and reduces the chance of aspiration, which is when fluid goes down the wrong pipe, meaning down the airway and into the lungs. The patient may have reduced neck mobility and control, so it is important that the patient's head and neck are comfortably positioned and supported. Finally, it is important to make sure that the pillows do not block the stoma, which would prevent breathing.
Following a laryngectomy, there are several physical changes about how your body works that you can expect. For example, you may experience decreased touch sensation in your mouth, in addition to reduced smell and taste, because air is no longer flowing through your nose and mouth. You will also be unable to blow your nose because you cannot exhale through your nose. You will breathe cold, dry air because warming and moistening the air you breathe is something that previously happened in your nose and mouth.
Any kind of major surgery can have a significant impact on a patient's emotional well-being. With respect to laryngectomy, emotional issues may arise from experiencing pain, difficulty swallowing, speaking, or being able to engage in daily activities. Mental health is an important part of recovery and should be monitored closely. Having a close support system, such as family and friends, are important to maintain a good quality of life. There are several local laryngectomy support groups that you can join as well. If further problems develop, it is recommended that you seek out a social worker, psychologist, clergy member, or psychiatrist.
Thank you for watching our presentation, and we hope that this has been helpful and informative. We've placed a list of our resources at the end of this presentation for further reading. Have a wonderful day!